Imagine leaving the hospital and finding out years later that something went terribly wrong. It happened to a local mother after she underwent surgery at the hospital that touts itself as the safest in Ventura County. As CBS 2's Serene Branson reports, she's now taking legal action.
I wake up every morning really nauseous and dehydrated.
Carol Critchfield is living what she calls a real-life medical nightmare. In 2007, the then 56-year-old went to Simi Valley Hospital for a standard hysterectomy and bladder support surgery. 3 days later, husband Mike took her back to the ER complaining of pain.
They took an x-ray and then they told me it appeared that I was severely constipated, and they pretty much just sent me home.
In 2009, more than a year later, Critchfield had returned from lunch to work at Simi Valley Unified.
I started to feel ill and faint and started to perspire and blurry vision.
Co-workers called an ambulance, and again she went to Simi Valley for an x-ray.
They came back saying that I had a gastrointestinal issue of some sort, and they told me to not eat any more spicy food and sent me on my way.
Fast forward to spring 2011. Critchfield was now bleeding and says her gynecologist said an ovarian cyst may be to blame. After removing her ovaries, they saw a mass.
It was not a mass inside my small intestine. It was a sponge that was left in, and it would become completely encased with scar tissue. So they had to remove a large amount of my intestine.
This is one of those never events. It should never have happened.
Steve Gambardella is now representing Critchfield in a suit against Simi Valley Hospital, the doctors and radiologists.
There were repetitive errors on so many different levels.
He says sponges like this one that was ultimately removed weren't counted as is protocol. And he points to this x-ray, which the radiologist noted showed something metallic, like the metal put in sponges so they show up.
She went on for 4 years with a sponge in her abdomen.
According to a study by Loyola University Healthcare Systems, about 1,500 medical instruments are left inside patients every year. About 1,000 of those are sponges.
This never should have gone beyond the first surgery.
Critchfield says the emotional scars are still fresh.
I had 4 children, never had stretch marks. I was proud of that fact, you know, and I like the fact that I look good for my husband. With the mass removal surgery, they had to cut me vertically. So I am so scarred up. If he does happen to see me, I hide the scarring. It's awful.
This statement of deficiencies from the State Department of Public Health shows the retained sponge or gauze was likely to cause serious injury or death. The hospital reported the incident in 2011 and was fined in 2012 $25,000. Then, months later, $50,000 for another patient in which an 8-inch surgical clamp was left in.
A spokesperson for Simi Valley Hospital declined a request for an on-camera interview. They did say it is against their policy to comment on pending litigation, and they also released this statement.
It reads in part, "We take our responsibility to our patients very seriously, which is why we self-reported this incident. This event was investigated by California Department of Public Health. It occurred in 2007, and since that time, we've implemented additional processes that further promote patient safety." They also point out a 2014 consumer report that gave Simi Valley the highest safety rating out of 6 Ventura County hospitals.
Just can't imagine that Simi Valley Hospital is going around saying they're the safest. I certainly hope that they have made strides to make it better. I wouldn't want this to happen to anybody.
Right now, there's a $250,000 cap for medical malpractice cases like this, but a bill currently in the state legislature is seeking to raise that to $1 million.